Male একদিকে protected, male andropause হয়, like menopause, এরকম ladies হয়, we also go through something called andropause. ওটা কিন্তু 10 বছর পরে হয়. Number 2, a male normally has more amount of calcium bone stock in their bones than ladies. So they will become later, they will also last longer. So another osteoporosis হয় but about 10 years after the ladies. Sir, symptomটা ওই আস্তে আস্তে you will start. So actually osteoporosis অনেকটাই silent. It's not completely silent but mostly silent. You will first have noticed when you have fallen somewhere and broken a bone. That's when it hits you that I am osteoporotic. Spine pain শুরু হতে হয়, muscle weakness হতে শুরু হয়. These are all transient and we equate everything to aging. That is not true. A lot of it is actually osteoporosis refracting together with vitamin D deficiency. So osteoporosis সঙ্গে সঙ্গে কিন্তু vitamin D deficiency হয়ে যায় and both of them add together. So a lot of symptoms are overlap from each other. Now how to remain healthy? So একটা হচ্ছে ছোটবেলা বললাম that if you are active, you play outdoor sports, not on your laptop or not on your desktop. If you play outdoor sports as a boy or as a girl, you will develop more strong inside your body. Second, if you have nutritional diet,
Amita.
in minerals, which is rich in calcium, which is rich in vitamin D, you will develop bone stock. Number 3, which is like an epidemic now in most cities, is not exposure to sunlight. You should have exposure to sunlight, and we sometimes have got so much in our head that kalo hoye jabo jabo na মেয়েদেরকে আরো বের করি না.
টাইমিংটা কি সানলাইটে নেওয়াটা?
Sir, you require about minimum 10 minutes of exposure. If you can go 15 to 20, but it's not the whole sunlight. It's early morning sunlight around between 6 to 10 and somewhere in the evenings around 4 to 5 p.m. When you have oblique rays coming in, that's the time when you get ultraviolet light exposures. If you get direct sunlight exposures, a lot of harmful rays also come. So these oblique rays which come to you during morning and evening, those of sunlight, but you need to expose yourself. So no point in going into sunlight with only your face being shown. So যদি ছেলেরা একটা এগিয়ে ভালো যদি গেঞ্জি টেঞ্জি পড়তে পারেন and with some short pants and then get exposed to it. So এটা বুঝলে why I explained to you. So ছোটবেলা যদি if you do these things, you have a better bone stock, you have good diet, good bone stock, you have played good sports, outdoor sports, you have good bone stock. Nutritional deficiencies, don't let that happen.
ছোট বাচ্চাদের তো hardly get to see playground, so they are always indoors.
Sir, playground না হলে না ওদেরকে নিচে দেখে যদি এমনি ছোটান, whenever you get time,
সাইকেল চালাবে বা
even the school should have playground. School should be able to put compulsory 1 hour of physical activities every
it
day.
is there. In the curriculum it is there. Even in my kids are going to school, they have this curriculum of weekly 3 or 4 days. This even karate class, yoga class in PT, and they do not in the indoor. They do
So
it out.
this is something responsibility of the schools also. Our children also have done it, and we force them. But the problem with school is the moment they have any tightness, this is a period they will take out and they will put one extra history class, extra geography class, extra science class. These are the periods which should be taken away. So I think we should insist, no, not at the cost of sports that I will do geography. I'm happy to stay back one extra hour in the school, but not at the cost of physical activity. So now comes the other time of the middle age, between 25 to 40. এই টাইমে কিন্তু আমাদের অ্যাক্টিভ রাখা উচিত. We should still be active. ওই জন্য physical activity is very, very important. Physical activity causes bone building, causes stress. Stress করলে কিন্তু বোন বাড়ে, কমে না. But we are talking mental stress, we are talking about physical stress. So very important, these exercises and nutrition values are very important. If you see the diet nowadays we have, it is either fried food, it is either preservative food, it is either foods with injected foods, or foods which have been kept in cold storage. We should have fresh food, we should have food directly from the farm with no intermediate stages. We should probably even eat raw foods if possible. I'm not talking about raw chicken or raw mutton, but raw fruits rather than having preserved foods. Raw vegetables just boiled or sauteed, but not really cooked. Quickly cooked out when you have bleached out with the water all the ingredients. So this is thing. Now what happens during menopause when I say how to take care of that? So that is the time when you need to look at are you undergoing normal menopause or are you undergoing accelerated menopause. So that's the time when you should see doctors. Maybe get yourself checked. There are investigations available. Luckily, we are in a good city, so we have DEXA scans. Smaller cities will not have DEXA scans. They probably have Q scans or something like a heel measurements. You can screen and you can start treatment. So you can remain healthy even at a later stage. But I think this is the period I want to stress because we believe in prevention more than actually cure. So if we can prevent this, we will never be able to prevent this forever, but we want to prevent this for a long time in your life. So, अपना क्वेश्चन का आंसर पहले नहीं आया बाकी अच्छे.
अच्छा आपने बोला
After 40s, it is more.
When you reach 9 age, a lot of time is gone. तब सर आपने ओके incentivize करते पड़े. जे if you want to do this, you do this because it is your house still. So children can't say it's my life. It is your house, it is your life, he is dependent. So you can give him incentive that to be into and don't force them to study. That is actually a school's responsibility. School should not dump homework and say that this is parents' responsibility. You send children to school for studying. But your responsibility is to keep physical activity. But you have to do that first. So give him some incentive to show, encourage his good activities. Maybe personally go out with him. আমাদের সবার প্রবলেম কি we don't
এটা আরো একটা স্যার বলতে চাইছি যেটা আমার
ব্রিজের উপরে একটা অ্যাক্সিডেন্ট হলো হলো you are standing there, you are walking on the bridge. Let's say you are walking, generally को पॉपुलर हाईवे ওখানে আপনার you are on a scooter, আপনার সামনে একটা স্কুটার যাচ্ছিল আর একটা ট্রেলার ওটাকে ব্যারিকেড পড়ে গেল ওটা. Now do I go away? আমার তাড়াহুড়ো আছে or do I stop? So at a humankind, good Samaritan tells you, "Na, amar eta dharma uchit. Maybe I can save this person's life." No work is more important than trying to save somebody's life. So I will stop. First, I will make sure that I am not an obstacle to somebody. So maskar rasta ami darabo na. I will bring my scooter to the extreme left. Now I have to get this person immediately out because see, people are going there. Before somebody might see, let's say there is a car. The car might go and the patient scooter the aste she bujhte paro na she he ran. This is called second hit. First hit to holo by the trailer. Second hit jate na hoy, I have to think. Ami eka ki korbo. So what I can do is I can stand in front before that person onto the way of oncoming and put my hand up and ask anybody who's coming to stop. So if you put your hand up, people will stop. You were the one who had the decision to make, should I stop or not? You require one or two people more. That you are the first person to just make sure that this area remains safe. Right? So, make sure that no traffic is coming on to hit both of you when you are trying to. Now you need to carry this person further. Left side road. You want to bring him on the curb. Either left side to where he is absolutely safe. Now, how to lift this patient safe? So, our second jinis jeta kharab hoy dekhi during helping. So, you are trying to help, into helping a someone or at a bhul hoye jay. First bhul hoy neck. So, neck is a very important aspect. Neck is very mobile. Dono neck injury hoye gechilo. Now, instead of the whole vertebra or half vertebra pode ache. Where the moment আমরা তুলি কিভাবে দুটো হাত তুলি দুটো পা তুলি, তাই তো? That's how we carry somebody. এবার ওর neck যদি কোনো কারণে accidentally পিছনে যায়, he will crack his neck and now his hands and legs are quadriplegic. Quadriplegia মানে no movement ever possible. So a person who was just hit and had an injury to the neck now is quadriplegic because somebody tried to help. So how can we be safe? So যখন আপনি হাত তুলছেন তার সঙ্গে সঙ্গে কিন্তু হাত ধরে you keep a support on his neck also, right? Or lifting from the shoulder with your elbows holding his neck also, so the neck does not move, and somebody else holds the legs, and you slowly bring him to the side.
Known as fragility fracture, and in road traffic accident, accident which is the most common cause of fatality throughout the world, India is ranking 1. India is number 1 as per data. India is number 1 in fatality resulting. We will be talking on different topics like how to manage or what are the golden period or golden hour when the patient reach and what should be the early management after road traffic accident. So the first thing is immediate after accident, the golden rule is patient should reach the center or any nearby hospital where primary care should be given, which we also call as ATLS, Advanced Trauma Life Support System, which is A, B, C, and D. First is airway, second is breathing, third most important is circulation. So first thing to be secured is airway. In majority of time after accident, patient is having cervical injury, which is most common in bike riders or in a car crash. When the patient come, they are not having limb injuries. They have majority of cases. Sometimes they have head injuries. Sometimes they have neck injuries or spinal cord injuries. In many centers or many people doesn't know, and they shift the people in, move the patient in not a proper position. That causes more fatality and more mortality in these patients. So while shifting also, we have encountered that in many cases while shifting the patient when coming to the center, we see that patient has been brought dead. That is because of not proper transportation, which is the basic thing to be learned for proper shifting of patient from when they are referring one patient from the trauma position site to the hospital. So first thing is proper transport. You have to identify which area is injured. Suppose nothing, patient is conscious, but first thing after accident, you should secure the neck and spinal cord to be examined first. So if there is any pain or any patient is having pain in the neck or back region, so he should not be moved abruptly. He should be placed supine on the board, strapped it, and then he should be transferred. So this is the first basic thing. Second thing to be see is where airway is maintained or not. Sometimes when patient is having a fall history or accident, so there are some obstruction in the nose and oral cavity, and patient is difficulty in breathing. So first thing is securing the airway. So securing the airway can save life. Breathing. You have to see the breathing. If there is difficulty in breathing, then you should give oxygen and then shift the patient. Then third is circulation. See. Circulation means you have to see whether peripheral pulses are there or not. You should first see vitals. BP and pulse should be checked in the primary area. If there is any bleeding area, patient is having bleeding or hemorrhage is there, you have to secure it, you have to tight it, bandage it, splint it, and then shift the patient. So this is all regarding the shifting and primary care to the patient when there is an accident. So what we are seeing in early diagnosis, proper transport of the patient, which is most important. And third is golden period. Golden period is what? The proper timingly shifting of patient. You have to act fast. Within the first few hours is most crucial for the patient for giving best outcome. If you are delaying the golden period, means there is increase in chance of mortality or morbidity for that patient. For example, if a patient is having an accident, if he is having any bleeding, and if you are delaying in shifting, or if a patient is having open wound, which is most commonly seen nowadays because of majority of patients are having road traffic accident, which is high energy trauma. Most common is bike accident or car crash, where there is an open fracture. The upper limb or lower limb, because of this trauma, where they are crashing on the ground and mopped like this, and then there is open fracture. Open fracture means bone is being exposed to the wound and it is soiled and dirty and with bleeding wound. So those patients, early care is required to prevent that limb and give functional limb. Otherwise, if there is delay in treatment, there is very high chance of infection, and it may also lead to amputation of the limb, either upper or lower limb. What is the advantage which we have, which has been developed nowadays, is the recent advances by good engineering we are and good implantation. Even in OT we have all the facilities like CM, live CM, X-rays machines, and all the monitors and investigations. So we can manage all sort of fractures, starting from cervical spine to lower limb till foot. all the injuries can be managed by initially what we used to do by open fracture and open fixation. Primarily, everyone used to, as an orthopedic surgeon, our previous older generation surgeons used to cut full length and then they have to operate it, so that increases the chance of infection, duration of surgeries. But nowadays, with advent of recent implants and newer designs, we can do it by MIPO technique. MIPO technique means we can do by percutaneous. No need for giving longer incision. We can do by micro incision, which we call it microsurgery. So in that way, we can insert all the implants, even plates and rods can be inserted by minimally invasive techniques, which can lead to early mobilization and early rehabilitation. Patient can go to work within 1 to 1.5 months of any sort of major accident. So that this decreases the time of stay of patient out of the work. Then coming to fragility fractures, means even the sports injury cases we are dealing, which I have already explained, that because of contact sports there is a lot of accident and patients are having all knee injuries, shoulder injuries, all ligament sorts of injuries that can be managed arthroscopically. Means all surgeries can be done by camera assisted navigated system, and they can go for early rehabilitation and go for sports activities again within months of their treatment. The third most important thing which we are covering today is osteoporotic fractures. Since nowadays the patient's lifespan has been increased, so what we are commonly seeing in our practice is elderly patients who are having fractures because of osteoporosis. So this osteoporosis should be managed, because once fracture occur in osteoporotic patient, it is difficult to unite first, and second, it is associated with increased morbidity because there is chance of less union in these bones. Second, even whatever implants we are applying in this osteoporotic bone, there is chance of cutout. His bones are fragile, so even if we are trying to fix it with implant, there is chance of failure of these implants. The implants are strong but bones are weak. So bones might break at the end of the implant. Where the implant is ending, from there the bones can break. So you have to take care of those patients also. Even in chronic patients, those who are long-term patients, those who are taking steroids and long-term management from steroids and immunosuppression drugs, those patients are also very fragile patients and they can go for fracture immediately after trivial fall, and those are difficult to treat. So you should act previously, act fast to prevent those osteoporosis and prevent those osteoporotic fractures. So what should be done in those cases? After 40 years, generally we should go for activities like walking, doing any type of work, weight training, resistance training like band exercises, and any sort of physical activity should be promoted after 40. 50s and 60s you should go for small weight training or resistance exercises will help in building the density of the bone. Second, your nutritional support. What in our lifestyle, what we are not doing in, we are not taking proper medications, not taking proper supplementation of calcium and vitamin B12 and D3, that causes bones to weaken and causes osteoporosis before our aging, and it causes osteoporotic fractures. So all these factors should be taken care of to prevent osteoporosis and thus leading to osteoporotic fractures.
Hi, good evening. We've gathered today here to talk and discuss about road safety program. Unfortunately, accidents do happen, but we should also be aware about what our responsibilities are if we
Should be promoted after 40. 50s and 60s you should go for small weight training or resistance exercises will help in building the density of the bone. Second, your nutritional support. What in our lifestyle, what we are not doing in, we are not taking proper medications, not taking proper supplementation of calcium and vitamin B12 and D3, that causes bones to weaken and causes osteoporosis before our aging, and it causes osteoporotic fractures. So all these factors should be taken care of to prevent osteoporosis and thus leading to osteoporotic fractures.
Hi, good evening. We've gathered today here to talk and discuss about road safety program. Unfortunately, accidents do happen, but we should also be aware about what our responsibilities are if we come across an accident case in front of us, how we can mobilize our resources, whatever we have, in better management of these accident victims right at the site of accident, and also how to transport them very safely to the nearest trauma centers. And then, of course, you should also be aware what happens afterwards in the trauma center. So there's a role to be played by every common person, and also every department, whether it's a fire safety department or the police or the traffic guards. So all of them have got a role to play. And of course, some roles will be played by other helpers from in the area. But doctors, nurses, and the technicians and the emergency departments will have the major role to play here.
Nowadays, sir, the accident is increasing too much high. Is there need too much emergency facility like local hospital, corporate hospital, etc., etc.?
Yeah, so there is no doubt that the accident and emergencies are increasing. We have also seen a different trend of the accidents. Before, we would see more accidents which were low velocity. Now we see high velocity because speeds are increasing, roads are getting bigger, roads are getting broader, and the traffic is moving faster. So I think this is an unfortunate corollary to this development project. We will see this more and more. We will also see more accidents from fall of heights, because now we have very big buildings coming up. So you'll also see people falling from height. People have gone into sports, into adventure sports. So you will see many accidents happen from the sporting point of view. So all these are going to happen. And unfortunately, when these things happen, we should be ready with infrastructure. Also, what we are doing, there's a lot of new developments which are happening both in initial management and also in the final management. I'll let my colleague Dr. Kushava talk about those aspects.
So what sir actually told that initial management which is most important. Once the patient is reaching the trauma care, the first thing which I have already explained, the first thing to be done is according to the ATLS score, that's airway, breathing, circulation, then primary screening of the patient. What is the primary scrutiny of the patient is being done. Then after care is done by the trauma surgeon, what as sir has explained, that all the teams should be present. If the patient is having abdominal injuries, your general surgeon should take care of it. If his patient is having a cardiac injury or a thoracic injury, then your cardiac surgeon should be there available. And trauma surgeon, as upper limb and lower limb surgeries are required, the trauma surgeons take the role.